Good morning, I'm Adam Sexton. As the season turns, doctors are beginning to worry about a new front opening in the fight against COVID-19, and that's the arrival of influenza. With symptoms that are nearly identical, the concern is a so-called twindemic that will put yet another strain on the system. Here this morning to discuss that and more is Dr. Michael Calderwood from Dartmouth-Hitchcock Medical Center. Thanks for joining us, Doctor.
Thank you for having me.
So what's going to happen when this overlap begins of flu season and the COVID-19 pandemic?
So there's been a lot of work that's gone into preparing for when we are seeing multiple respiratory viruses, flu being the main one, but there are a few others that are circulating around the same time. And the real focus is going to be making sure that we get people in quick for testing. And when we're testing for one, we're testing really for both COVID, flu, and often also respiratory syncytial virus or RSV as well.
What's the trend as you see it right now with the COVID-19 numbers in New Hampshire? That level of community transmission, thankfully, still seems to be fairly low.
We did see an increase through mid-September, and when we were looking at 7-day averages, we were going from probably at our best in mid-August, around 15 new cases statewide per day on average, and it got up closer to 40. We seem to have plateaued, and there's some evidence that it's coming down. I do think that the positive is that we were not seeing a large increase in patients being hospitalized or deaths. And so many of these new cases were because of increases in testing as we were doing more around schools and colleges reopening.
Is that because the patients were younger? Is there, I mean, the reason why in terms we were seeing fewer hospitalizations, why was that, Doctor?
As we are doing more testing, we are testing more individuals who are younger, and so we are seeing more positives in that group. And so we know throughout this pandemic that those who are young have tended to be less likely to get seriously ill, to be hospitalized, or to die. In fact, when we look at individuals under the age of 20, we haven't had any deaths in northern New England, not just New Hampshire, but all the surrounding states as well.
Speaking of youth, what's your perspective on school reopenings so far? And let's start with college campuses.
You know, I think the colleges are an interesting environment in that you don't just have people there for classes during the day, but this is a time where people are congregating, living together in dorms, and obviously there are unknowns around parties and other kind of out-of-classroom gatherings. I think the colleges have actually done a very good job in terms of testing and communicating with students. I will say, at least locally, here around Dartmouth-Hitchcock Medical Center and Dartmouth College, I've been quite impressed by what I'm seeing out in the community in terms of this students both socially distancing and wearing masks. I do worry as we go forward through the fall that we will reach a period of some complacency, as we've seen in other areas, not just in schools, but out in the community. And unfortunately, this is not going away. And so this is going to have to be something we focus on, not just in September, but all the way through next spring or until when we begin to see vaccines and other therapies available that can help us to better handle the pandemic.
What about K through 12, Doctor, in particular in-person education? So far, we haven't really seen any outbreaks connected to the schools that did go back into the classroom. Is that just luck of the draw, or is there growing evidence now that classroom transmission in those younger ages isn't as bad as people might have thought?
You know, I don't think it's a one-size-fits-all, and things are different for elementary and potentially middle school age children than for high school age children. And I think it really depends on the local prevalence. And so if you're in a community that has a lot more circulating virus, we're going to have people who are asymptomatic and can bring things into classrooms, and we're going to have more spread. And so the state has very clearly outlined what is kind of low and medium and high risk in terms of community testing numbers that would suggest you could be full in person, you should be hybrid, or you should be remote. And I think that really the places that have gone to full in person have been very successful. But to do that, They really had to come together as a community to think through how they were going to make that safe. And there's a lot of changes that the schools had to make in order to make sure that both the students and the teachers and all of their staff were safe in that environment. I think they've done a wonderful job, but it's not a one-size-fits-all.
All summer long, we've sort of been tracking this pattern with the large group gatherings, whether it's a large campaign event with President Trump or a Black Lives Matter march, NASCAR events, Bike Week. You see some of these pictures and people sometimes wince and say, oh gosh, here we go, this is a real danger. And yet public health at the state level, they found no clusters of COVID-19 connected to those events. Was that just luck, or were people behaving in a manner with enough safety that it ended up working out?
You know, it's hard to talk about specific events. What I will say is we do know that after big 3-day weekends, and we've seen an increase in certain areas of the country after kind of Memorial Day, 4th of July. Similarly, places are experiencing that after Labor Day. And we did see an increase. It's hard to know how much was due to travel around that holiday, because at the same time, schools were opening, other things were happening. What I would say, I mentioned earlier complacency. And so we have people that are beginning to look ahead to the holidays and what is Thanksgiving going to look like this year? What is Christmas going to look like this year? And, it is safer if you're traveling to travel by personal car than to get on public transportation, such as airplanes and being in close proximity to others, even if you're doing everything, including testing and wearing a mask. But also when you're choosing where you travel, there are parts of the country where we're seeing a lot more cases. And in these hotspots, you want to be thinking, is this the right time to travel to those areas? And if I'm going to make a choice to travel to those areas, what am I going to do while I'm there? So this is not, say, the time to go to a large wedding or a large theme park, particularly in some of these areas where they're seeing large increases in cases. And so we have to think about what we can do to be as safe as possible, both so we're protecting ourselves and our family, but also when we return from those travels, that we're not bringing things back that may impact our community.
Yeah, we just heard from the person leading contact tracing at Public Health for the state level that it's really the small gatherings, like you mentioned, at 4th of July, Memorial Day, Labor Day, that have driven the community transmission here. Why is that those events you see more spread versus the larger events? What is it that people are doing at these smaller in-person gatherings that is spreading the virus?
There's been a lot of focus on bubbles and thinking about what is the appropriate size of a bubble. As this goes on for months and months, people expand and think about close communities of friends and neighbors that they make decisions to bring into their bubble. In the summer, that was easier because we were doing a lot of eating, say, outside on porches. As we go into the colder months, the question is going to be, can you truly bring groups together, say for a dinner party, in an inside location? And that clearly is going to be riskier, and we have to think about how we've defined those bubbles. What we know around holidays is that we have a lot more travel, and so people tend to be coming to these gatherings from further outside the state, from other parts of the country. And what might have been a small, close-knit bubble at a barbecue starts to incorporate other individuals. And so we have more mixing and more chance for transmission, particularly if individuals are not wearing masks.
You mentioned the complacency. What's one thing you see people doing or starting to do more of right now that makes you say, ooh, gosh, I wish people wouldn't do X? What is that?
I think that again, I really do focus on the importance of masks. And when we are out in the community, and particularly when we can't maintain a 6-foot distance from others, wearing that mask both to protect ourselves, but not knowing at any given time the possibility that we may be asymptomatic and a risk for transmitting to others. So the mask is the first thing that I would focus on. The second is around size, and I think that particularly as schools have opened up, we are doing more sports, we're thinking about more travel, and questions come up around, okay, Can I have a sleepover with this group? How large could that be? Can I have a birthday party? How large could that be? And I'm not going to give a definitive answer on kind of what is right. People do have to make some personal choices. What we know is that larger gatherings are more risk. When we are gathering with people who have traveled from outside our local community, it's a higher risk. And when we aren't keeping that physical distance, particularly without a mask, that is also a higher risk.
All right, Dr. Michael Calderwood, thank you so much for your insight, and best of luck as you navigate through this pandemic.
Thank you very much for having me.